Hello, my name is Hyun Park. I'm a prosthetic urologist practicing in Seoul, South Korea. I was invited to the UAA meeting in Dubai recently. UAA is a Urological Association of Asia. So one of the other, similar conferences could be American Urological Association annual meeting or the EUA. The size of the conference and all the people gathered around was more than 3,000 people. They had rented the whole Conrad Hotel for a meeting venue. And not just Asian continents, but the Middle East and all the other, people around the region gathered around for the conference. It was a huge meeting. Just like before, I was invited for a live IPP surgery session, and also they wanted to give a talk about the IPP surgery in the later section. But on the morning of the surgical day, they called me, and unfortunately, the surgical case patient said he wanted to cancel the surgery. So I had to quickly reorganize my talk because the time allotted to my live surgery was 45 minutes. So then I gathered around my videos of the surgeries or difficult cases, something like that, and stacked it up and gave them a presentation. As it was me talking about, and my surgical video is played at background, there were several moderators sitting down. And one of the moderators came to me before the talk and told me, Dr. Park, we're going to ask you a lot of questions so that we can entertain the crowd. So just like he said, through the discussion, they asked me a barrage of the questions. Because the method I do is a subcoronal approach, and I time to time do the local anesthesia, which is really something new for them. They generally do the surgery under general anesthesia or rarely in the spinal. So, and also most of them are doing the just scrotal or the infrapubic. But surprisingly, rather than a live surgery, semi-live was actually went really better than the live surgery. But as it was a semi-live surgery, I didn't have no obligation doing the surgery, just standing there and answering the questions while watching the video. So I was able to gather my thought, and I was able to deliver what I have to. Attendees also didn't have a burden throwing me questions because I was not doing the surgery. So quite unexpectedly, but the live surgery case semi-live actually went really well. I had another talk about the surgical approach, but that talk was not really interesting because I already talked everything about the subcoronal approach in the morning session. So overall, it was a great experience for me. And again, it was an eye-opening experience because I always attended the sexual meetings generally, but now I am getting more exposed to the general urologist meetings. And again, not many surgeons know about this surgical modality, because IPPs are still not really well discussed about. It's a great honor and joy to keep talking about this subject, and I hope to doing so in the future as well.